there, Miss Ford. My name is Erin Miller. I'm going to go ahead and be your nurse today. I just wanted to sit down with you real quick because I do see that your doctor has a new prescription for amiodarone for you. And before we sent you home on it, we just wanted to go ahead and sit down and kind of talk through and see if you have any questions since it is a new prescription. I will be going over this fun little sort of pamphlet or brochure that you're more than welcome to take home with you. Just kind of talking through of like why you were diagnosed amiodarone, what's it used for, some common side effects, things like that. And so we'll be going through that before we send it home with you, okay? Okay, so first and foremost, amiodarone or amiodarone hydrochloride. That's just a really long sort of fancy name. That's typically what you're going to hear this drug referred to as pretty much anywhere you go. That's standard. It's its generic name. If you say amiodarone, most medical providers will know what you're talking about and what it's being used for. But some other names, they're like brand names that you might hear it under, is Nexterone, and that's typically when it's being given through an IV. In like the acute hospital setting, or Pacerone, which is when it's given in tablet form, like you have here, right? So first and foremost, you might have a question of why you were prescribed amiodarone. Now, usually this is used to treat life-threatening ventricular fibrillation or ventricular tachycardia, and that's just when your heartbeat is not beating the way it's supposed to. It's kind of beating out of time. Your heart's not doing what it's supposed to, or it's beating really, really fast, and that can actually have some pretty detrimental effects. It can affect your body pretty badly. So they prescribe amiodarone to kind of help get that in check. Now, in your case, your doctor prescribed you amiodarone because of your atrial fibrillation, or that AFib. I'm sure you've heard that before. And that just means that your heart normally should be beating very consistently, very evenly at a certain pace, right? But your heart, what it's kind of doing, it's firing off heartbeats a little bit irregularly, which can ultimately have some pretty negative long-term effects, or put you at a higher risk for things we want to avoid, like a heart attack or stroke, which sound very, very scary. But if you think about it, if your blood is not able to get out of the chambers of your heart the way it needs to, it just kind of sits there and pools. And anytime blood sits and pools for too long, it clots up. And obviously clot's kind of a scary word. If that clot is in your heart, it can easily travel to your brain and cause something like a stroke. So that's why it's super important for us to put you into what we call normal sinus rhythm. And that's how we want our heart to normally beat. Again, really good contractions, really even, at a good rate, and it's just behaving the way we want your heart to behave, right? So that's why you were prescribed the amiodarone, because it helps you do that. Actually, there's a little link on the back of your pamphlet, and it has a nice little QR code that'll take you right to that link. The National Institute of Medicine has this online library that has a lot of these peer-reviewed articles and like case studies that talk a little bit about the research being done into using amiodarone to manage AFib. And it's really interesting. The study that's linked on this pamphlet actually shows that class 3 antiarrhythmic medications like amiodarone actually have been widely used to treat AFib and kind of convert you back into normal sinus rhythm. And it shows in this particular study that it could reduce, using amiodarone to treat AFib can actually reduce the recurrence rate to about 20 to 50%, which may not seem like a lot, but when you think about it, that's actually a huge percentage, and it shows that it's effective, and it kind of provides evidence of why your doctor may be prescribing it for you, okay? Like I said, in case you want to do any more research, it is linked back here for you, and it also talks a little bit about the condition of AFib in case you had questions about that. So let's kind of get into the meat and potatoes of everything, right? So basically, how amiodarone works is it's going to slow your heart rate down so that your heart can kind of beat more effectively and consistently in that normal sinus rhythm pattern that we want our heart to normally work at, right? It also does something called vasodilation, which essentially means that it's increasing the available oxygen that can get to your heart. This helps your heart kind of calm down, it's not oxygen hungry, and because it's getting oxygen, it doesn't have to work that hard. And so it actually increases how effective your heart is beating and kind of gets you back into that even sinus rhythm that we're wanting to get to, right? Now, I see here that your doctor has prescribed you the low starting dose of 400 milligrams. You're going to be taking that daily in divided doses for 2 to 4 weeks. And after that, I'll actually change your prescription to what we call a maintenance dose. So it's going to be much lower to just, we've corrected you, hopefully we've put you back into normal sinus rhythm, and we're going to give you a lower dose to kind of maintain that with as little side effects as possible. And that's going to be about 100 milligrams divided dose daily. So how are we going to take it? Well, we open into your nifty little pamphlet. Essentially, you're going to take it at the same time every single day. So I would find a time that works best for you. I would set an alarm on your phone, and you're going to take it at the same time every day. The biggest thing is we are not going to skip our doses, and if we do for some reason miss a dose, we are not going to double up on doses. It just shows that when you do that, it can throw your heart out of rhythm really easily, and we don't want to put you at a risk of developing a very like a life-threatening sort of heart rhythm, right? So same time every day, and do not skip or double a dose. It doesn't matter if you take it with food or not, though there is a little note in here that says it is recommended to take with food, just because one of its side effects, it can cause a little bit of tummy trouble, some GI upset, and it's been shown that when you take it with food, it can decrease that a little bit. The biggest takeaway is you want to make sure that you tell every medical provider you see that you are on amiodarone, because there are certain drugs that we can't prescribe with it, or certain drugs that it can interact in a bad way with. So you want to make sure that any sort of health care provider you're going to see, you just let them know that you're taking amiodarone, okay? So, before we move on to that, I'm just going to talk a little bit about drug interactions. I know I just said that it can affect what your other doctors are able to prescribe for you. So here are just some of the most common things that amiodarone can interact with. You want to be careful using it with anticoagulants because it can actually increase your risk of bleeding risk. That's going to be like your NSAIDs, your aspirins. So if you're taking that for any type of pain, I would recommend maybe switching over to like acetaminophen, things like that don't necessarily have that same component. We want to be careful if you're on or do get prescribed in the future any type of antibiotics specifically, and these are complicated names, so you can always sort of ask for reference when you're there, but specifically for fluoroquinolones and macrolides, just because when you take them at the same time as amiodarone, we've been talking about those heart rhythms, it can throw you into a life-threatening ventricular dysrhythmia. And that's just a fancy word of saying your heart kind of freaks out. And we really don't want that. So make sure that you're telling. If I don't see anything on your medical history or your during your med reconciliation, I don't see anything that you're on a beta blocker or calcium channel blocker. However, should you get put onto something, or should you talk to your doctor and they're wanting to consider putting you on a beta blocker or calcium channel blocker, again, just let them know you're taking amiodarone, just because when you take them together, they can actually slow your heart rate and lower your blood pressure way too fast, which can be really, really dangerous. So make sure to let someone know about that. Again, I didn't see that you were prescribed digoxin, but if for some reason in the future you are put on digoxin, again, just let someone know you're on amiodarone, just because when you're on digoxin, they really want to titrate those levels, that medication level in your blood, to reduce your risk of developing toxicity to that medication. And unfortunately, amiodarone can actually increase your risk of toxicity when you're on digoxin. It just makes you reach those toxic levels a little bit faster than you normally would. The biggest thing for you, since I don't see that you have any type of other medications that you're on, the normal things you want to stay away from are like grapefruit juice. And if you take any type of like herbal complementary medicine like St. John's wort, we want to make sure we avoid grapefruit juice and St. John's wort, because these can actually affect the effectiveness of amiodarone. Either it heightens your effects too much, and that's with grapefruit juice, or it doesn't make your amiodarone work effectively, and that's with St. John's wort, which obviously, if it has to do with your heart, we want to make sure that your medication is working as best as possible. Let's talk about side effects, because I'm sure that's what you're most concerned about, right? How is this going to affect me? So some of the common side effects, you might feel dizzy, you might feel fatigued, it's going to slow your heart rate down. That's kind of what we're wanting it to do. So if you're used to having a super high heart rate, the minute that we get it back into those quote unquote normal levels, that's where the dizziness and tiredness can come from, because your body is trying to learn what its new normal is, right? You can have confusion, headache. If you take amiodarone long enough, sometimes it can actually cause a blue-gray discoloration of your skin, which sounds wild, right? But typically pretty harmless. That's just something you can affect, and we like to warn people about, especially if you're going to be on amiodarone for a long time. Just because obviously if you wake up and your skin looks a little bit blue, you want to freak out, but it's no cause for concern. And then it can cause light sensitivity and something called visual halos, which just kind of affects, you can get like little rings of light in your vision. The biggest thing here, and don't let this scare you off, but it can cause something called corneal microdeposits, which is just a fancy way of saying that the medication kind of builds up in your body and can basically build up into your tear ducts, right? Which in theory could cause visual changes in rare occurrences. And again, in rare occurrences can even lead to something like blindness. However, remember those nifty little links I have on the back of your pamphlet? There is another one on that same NIH website that actually published a study that showed that about 90% of patients end up developing some degree of those corneal microdeposits. However, in that 90%, really only about 10% of these patients will develop actual visual symptoms at all. The biggest reason we mention it is because I'm sure you remember you met with that eye doctor before we decided to put you on amiodarone, and that's to get that visual baseline, to see what your normal is, so we can monitor if any vision changes happen. The biggest thing is that when you're on amiodarone, you want to make sure that you're having frequent and regular eye checkups to just monitor for things like that, right? Okay. So that's what you can kind of expect. Now, here are some severe or rare side effects that can occur, and they are, again, severe. There are something to be taken seriously. They don't happen in every patient, but it is something to monitor for. So the biggest thing is, because amiodarone affects your heart, of course, in severe cases, it can lead to things like cardiac arrest, heart failure. Amiodarone is also very hard on your liver and kidneys, so in rare cases, it can lead to liver failure, kidney failure, pancreatitis in some cases, poor clotting, which is why we talked about it with those anticoagulants, those aspirins and NSAIDs. It can actually increase your risk of bleeding, just because it can stop your body from being able to produce platelets, which are those little tiny components in our blood that help us kind of like clot and stop bleeding and things like that. It can also, in some rare cases, cause respiratory distress and something called pulmonary fibrosis, which basically means that the tissues in your lung become too thick or scarred, which can affect your ability to breathe. And then in rare cases, you can, like any other medication that you're getting started on that's new, you can have a potential anaphylactic reaction to it. Now, all of that sounds scary, and you're probably thinking, how would I know? How would I know that any of that stuff is happening? Well, on your pamphlet, in red, in this nifty little section here, this tells you about some signs and symptoms to report to your doctor immediately. So if you have any new chest pain, if you have any new occurrence of shortness of breath, if you have new or severe bruising that you can't think back, like if you see bruising all along your thigh and you can't ever remember bumping into something or hurting yourself and you can't explain why you have that bruise, make sure to do body scans when you're getting into the shower just to check for new and severe bruising. If you go to the bathroom and see that your urine suddenly becomes a very dark sort of brown color, because that can be indicative of that kidney failure that we were talking about. If you experience any excessive vomiting, If you wake up one day and see yellowing of the skin or the eyes, that's called jaundice, and that can be a sign of liver failure. We want to make sure that we're looking for a sudden and prolonged quickening of your pulse. So if you're just sitting down and you're not exercising, you're not, getting up and doing something that's making your blood pump. If you're just sitting there and all of a sudden you feel, wow, I'm having a really fast pulse and it lasts for a long time, make sure to monitor for that. And then, of course, if you have any new or worsening visual impairment or swelling of the lips, face, tongue, hands, that kind of stuff, because that can be indicative of a anaphylactic reaction. If you experience any of those, I don't think you'll miss it. I put a little ambulance down there on your pamphlet. That means that you are going to seek immediate medical attention. Those are medical emergencies, okay? So you're going to find your way to an ER, and then we'll treat that. And either see if we need to adjust your doses of amiodarone or if we need to take you off it altogether and kind of start from scratch, right? So, biggest thing, that's a lot. I don't mean to fire hydrant you with all this information, but most of the big signs down here are kind of highlighted on your teaching portion for what you to be aware of. So, like I said, I've said it a million times. You're probably going to get sick of me saying it, but you want to make sure that you inform all of your medical providers that you're taking amiodarone, because this can affect what they're able to prescribe for you. Again, you want to plan to have those regular and frequent eye checkups with an ophthalmologist or that eye doctor while taking amiodarone to make sure that, your vision is staying exactly, there's no negative or decreases in your vision, right? We want to, a big one, because of all of those, we have all of those signs and symptoms you get to look out for when things are getting severe, or you can have negative reactions or those rare side effects. But also expect that about every 6 months or so, you're going to come back into the office and we're actually going to check your liver and your thyroid function, again, to assess for any of those really negative rare side effects. Also, if you are taking amiodarone, you want to make sure that you're using effective contraceptives while taking amiodarone, and tell your doctor if you suspect or are wanting to become pregnant, just because amiodarone has been shown in several cases to have very negative and harmful effects on the fetus. So we don't want to become pregnant while we are taking amiodarone. It doesn't mean that you can't. We just need to kind of have some type of consult with that to see if there's something else we can prescribe you. That being said, if I don't see that you've just had a child, but let's say that you do have a child and you want to breastfeed that child, you cannot breastfeed that child while on amiodarone. That can be passed through the breast milk and be really, really bad for baby, okay? Again, no St. John's wort, no grapefruit juice. I would just stay away from those two altogether, just to play on the safe side. Again, take your medication at the same time every day. Don't skip or double a dose. And then the other thing, because it can cause photosensitivity, that light sensitivity, skin sensitivity, we want to make sure that if you are going to spend prolonged periods of time outside, that you're wearing protective clothing, sunscreen, sunglasses, just to protect you while you're taking amiodarone, okay? If you have any questions, like I said, you have these little links down here to follow, but please feel free to call us anytime. We'd be more than happy to answer your questions. As of right now, do you have any questions for me? Okay. So this pill bottle can seem a little bit scary, right? Especially because this is a medication that you want to take at the same time every day and never want to skip or double your doses. So what I would recommend for you to be able to adhere to this medication protocol, right? You can actually run down to like the dollar store or a Walmart, and they have this really nifty sort of pill case, right? It has all of your days of the week lined out, and you can kind of open it up and set aside your pill or any other medications that you're taking and kind of set them in there collectively and snap that lid closed. And that way, when you that allows you to kind of, I don't know, have you ever meal planned before? That allows you to kind of get all of your doses set up for the week. So that way, when you're in a rush in the morning, you can go ahead and pop open the Monday tab, pour them into your hands, and you know that you're taking the right dose. And then when you come back and you think, oh gosh, it was a long day, did I take my pills? You can check and see that there are no pills in that Monday slot, and it kind of keeps you on track. That's one of the things that can help. Another way that, another thing that I want to teach you before you go, we were talking about for those severe cases, if you feel like your heart rate has sped up, or that like pulse pressure has sped up, we'll just teach you how to take your own pulse. So the quickest, easiest way that I would recommend, if you can afford it, if you can go to your local Walmart, they have something called a pulse oximeter. It's one of those little things that we put on your finger, and that tells you how well you're oxygenating, or how well you're taking in oxygen, right? But on those little monitors, there's actually a little nifty thing that takes your pulse, and it'll tell you your heart rate. We want our heart rate anywhere between 60 to 100 beats per minute. So if you see that it's above that 100 and it's staying that way for a while, that's one of the reasons that you can kind of check that quickened, prolonged pulse and see if you need to go to seek emergency medicine, like the ER, the ED, right? But if you don't have one of those, you can actually go into your radial pulse. It's right over here. You kind of feel around, and then when you know that you have found it, you'll feel this sort of like pulsing pressure on your two fingers here. And if you count that while you're staring at a clock for a full 60 seconds, that'll give you a pretty good indication on what your pulse rate is, or that heart rate. So if you count for a full minute while holding here and you can feel those pulses, again, we want anywhere from 60 to 100 beats per minute. So if it's anything higher than that, and I mean much higher, like 120, 150, those kind of things, that's when you can know if you need to seek medical attention, right? Okay. If there is anything else that you can think of, please do not hesitate to reach out to me. Again, my name is Erin, and I hope you have a great day. Here's your medications and your brochure.